Algenon Cash, and you're locked in. Welcome back, you all. Thank you all for joining me for another great episode here. Got a new friend, well, actually, somewhat of an old friend. We just reconnected. I've got Shannon Hodge that's going to join us today to talk more about senior care. But before we get into that, it is the holiday season. And obviously, COVID is raging right now. We are seeing higher than normal spread of COVID-19. So, holiday plans have been disrupted for so many people. So, I do want to make sure you know sponsoring today's episode is JNS Cafeteria, who's located at 5835 Samet Drive in High Point. And they want to do the cooking for you this year. So, if you want to stay out of the kitchen and you want to focus on your family and not have to worry about cooking and cleaning and doing all those kind of great things, I want you to reach out to JNS Cafeteria. They do have holiday meals that you can pick up. They can deliver, but you can go over and pick up a holiday meal that feeds up to 8 people. So you know you're not supposed to have a lot of people over your house right now. So the holiday meal for 8 people is perfect. That's spot on. But you don't have to do the cooking. Again, when you go over to JNS, when you contact them, tell them Algenon Cash sent you. That way they'll give you a nice deal and they'll hook you up. But again, that's JNS Cafeteria over in High Point. So like I said, today I've got Shannon Hodge. Shannon Hodge is locking in with us. Shannon is a former CEO of a home health company. She's also an expert on senior care. And I really wanted to invite Shannon on to talk with us today simply because it is the holiday season. This has been a year where we've dealt with COVID all year long. I don't know about you all, but I haven't really been able to be around my grandmother in a very long time. She's been obviously very sensitive to people coming over to the house. We've taken things over, but we leave them out on the porch for her. And she's someone that is typically very active, spends a lot of time at her church and fellowshipping with her friends. But this has been a year where she's been in extreme isolation. And typically she would see her kids and her grandkids around this time of the year, but she won't. And there's so many people out there in my audience that sharing that same experience. And I'm concerned, and that this may have an impact on the mental health of our elderly population. So I invited Shannon on to talk about that. Shannon, how are you today? You're locked in.
I'm so well. Thank you very much. Thank you very much. I'm doing great. You can see Christmas is here, so I'm really good.
Well, you've got a nice, big, beautiful tree. You're embarrassing me. I've got my little Charlie Brown tree back there, and you come in with this big thing, and but no, it looks great, and love the background, the whole deal. Just to set it up for my audience,
Yeah.
I originally met Shannon probably 10 years ago, maybe
Long
even a
time
little
ago.
longer, when I used to be a little bit more active and involved at the Piedmont Club. Met her there, and I also had a short stint in the home health business. I was a partner with a home health company out of Greensboro for about a year. Certainly didn't learn nowhere near as much about it as Shannon did. And so we're going to talk a little bit about that as well. Obviously, she's a
Okay.
small
Yeah.
business owner and the whole deal. But Shannon, just to sort of kick off to it, I know we talked off air yesterday, just setting up this interview. And you're someone that you've got a lot of experience working with seniors. You actually were in a business where you all would send out nurses to take care of seniors in their home and make sure they had someone there to comfort them and take care of things around the house. I mean,
Yeah.
what's going on now with our elderly population in a COVID-19 environment?
Yeah. So, actually it's just a new season for everybody. It's not just a new season for seniors, but they're the ones that are really, really on the rise of increase for mental health. We are, Algenon, you and I will go to the grocery store. We will go to the gas station. We'll go and do our normal day-to-day living activities with the mask, with the hand sanitizer, with all the precautions that we're supposed to. But this generation doesn't do that. This generation has always been one to be reserved, follow rules, policy, procedure, limit the risk, because they actually have chronic conditions that are a little bit more serious than ours. So they're staying in, they're staying home, and staying safe. But that's great. But unfortunately, that does play on their mental health for a lot of things. Anxiety and depression that's actually what's on the rise for seniors is the anxiety and the depression. And, anxiety just can come from not knowing if there's going to be, if this is going to be fixed in the next 12 months. We thought we were going to be going through this for just a few months. And so their anxiety and depression wasn't as heightened as it is now. But and most seniors already have anxiety and depression. So it's really enhanced at this point. And so, what we have to do on our end plays a vital role in their overall mental health. We can't take that away. But there's things that we can do as a community and as neighbors and as family to really bring some joy and some light and some hope, because that really robs them. Depression, anxiety will rob anybody. Now, let's add that to an 80-year-old who doesn't go out at all. There's no social interaction whatsoever. There's no going to the grocery store. There's no going to the gas station. There's no one-on-one contact. And so what happens is you get that retreat, and then that mental health goes very dangerously high. And medication is big. What happens if they're not taking their anxiety and depression medication as they're supposed to on a normal basis? So, our concern and, for senior care industry, that, and even for me personally, is the doctor appointments. They're not going to go to the doctor. They're not going to get out and go to the doctor's appointment. And it's very rare that they have this where they can do visual for, maybe teledoc, telehealth, something. And so they're like, no, I'm not going to go to the doctor, until this goes away.
Yeah. Let me ask you this question, Shannon. I mean, with the home health business right now, I know so many seniors are very sensitive to the idea of people coming in and out of their homes because of the virus.
Yes.
What impact has COVID had on the home health business and that industry?
Actually, it's actually comforting for them to have service, and it's actually increasing. So, when they come home from the hospital because they've had COVID and then they're out of quarantine, who's going to fix their meal? Because I'm telling you, this COVID is, it will rob you and cost you some very strong fatigue, loss of appetite. And so when you don't have someone there that's preparing the meal, doing the medication reminder, they're not able to get in the shower by themselves and bathe. That then with the precautions, as long as the company is following CDC regulations and the employees are being responsible and not showing up to work when they have symptoms, and then seniors they're really okay with it, because they know how important it is for their health. But it's short, in and out. Let's do what needs to get done. But if there's hospitalization, they come home, then there needs to be that overnight 24-hour, and they're okay with that. And so is the family. Helps the family.
Are the actual, I know from even when I was in the business, I mean, home health agencies have to go through an extensive screening process to make sure you're sending someone that's qualified into the home. Help us understand what additional precautions and measures are home health agencies having to go through in this COVID environment? I mean, are they having their nurses, are the nurses getting tested for COVID or?
Yeah, so CDC regulations aren't something to mess around or play with, and it's not anything to actually negotiate with. So hand sanitizer, masks, clean masks. If you have any symptoms whatsoever, even if you feel lightheaded or dizzy or nauseous, then don't even come. Don't even worry about it. But the CDC regulations for home care agencies right now they're very, very strict, and rightfully so. Rules and regulations are for protection. That's what they're there for. And just think, if you were in your 70s or 80s right now and you were calling a home care agency, wouldn't you want those regulations in place in order for your safety? Because this is your home. They're coming into your home. You don't know what they're bringing in. You don't know if their grandson was sick or their daughter or they've been sick. So, you do have to be, there are CDC regulations that have to be signed off on for an employee to return back to work. And they're very simple. They're very, very simple things. But an employee has to sign off on those three things, stating that those 3 to 4, if the company wanted to add one, that they're okay to return back. So it's tough.
So there's been a explosion of home health agencies, certainly here in North Carolina and across the country.
Yeah.
For my audience that's watching today that maybe uses a home health agency, help them understand how is it regulated? Because I could go open a home health agency and maybe I'm not following all these CDC guidelines that you're talking about. How would someone in my audience, how would they know?
Yeah, that's a very, very good question. There is the Department of Health and Human Services, DHHS website is your primary go-to for any home healthcare agency. It's going to list on there if they are licensed, which is pretty major. And then, the health department, even here locally, and the ombudsman, they are very good resources to use on a local level for in your local area. The CDC, they're more to set out the regulations, but you've got the Department of Labor that will be getting involved, because you've also got this COVID relief for employees that, along with FMLA, now you've got this COVID relief. So, you've got the Department of Labor that can be involved as well. There's a lot more hands in the pot than there used to be. But that's good. That's good. That's good for the employee. It's good for the client and the consumer, and it's good for the organization as well. So number one place to start is DHHS, and the Department of Health and Human Services will have that listed agency county by county, and that will be your number one first start.
With that website, if there was like any infractions against that agency, would it be listed there at all, or?
You actually have to call for that.
Okay.
They do not list that publicly.
Okay.
You do have to call and speak one-on-one with someone about that. And,
yeah,
and if that agency does, they will tell you, but the agency is actually obligated to tell you if they do.
Yeah, I know, like in the restaurant business, if you get a health inspection, right, and you have any infractions, they're going to list it on that public health website for people to go read about. So yeah, it is.
Wow.
It's very public. And so maybe it's a little different in the in-home care business, but
it is.
I'm also wondering, I mean, it is the holiday season. A lot of seniors are not leaving their homes. They may have a nurse coming in that's taking care of them and doing those kind of things. For my audience that may have a parent or an elderly relative that might be in the situation that we just described, do you have any tips for them on things they could do that still engages with the senior, but allows for that social distancing to still be there? Or?
Yes. Yeah. And so, personally, my 70-year-old in-laws, we haven't seen them since March. They're not coming out. They won't come to see us. If we go by to see them, it's like a hi and a wave. And so, you have to get really creative. Luckily, we have, you've got FedEx, UPS, and USPS. So you've got ways to do things. But, visual visitation is always wonderful. You can just get an iPad or a phone, or, you've got the Google, you've got the Alexa. You can do visual visitation now. That visual is very, very important. Mailing letters and cards. This generation loves snail mail. They like going to the mailbox, getting something out of the mail. That is just, there's just something about that with them that they really like. Those Christmas cards are really meaningful for them. There's a personal activity basket that you can make with things that they enjoy. They may be puzzles, crossword puzzles. It may be their favorite little snack or food. So a personal care basket is really, really a good idea. we all want to feel like we're contributing to society, and we all want to feel like we have value. And this generation that I think so highly of in their baking, they love to cook. They love to cook. So when it's like Christmas or Thanksgiving or birthday or Easter, you know what they do? They cook, they bake. So, it's a really good idea for you just to take something there that they can bake. And if you have a family of 4 that they're not going to be coming to, ask them to bake something for your Christmas holiday, and then go pick it up and bring it, because then they're still contributing. They feel a part of it, and take them a plate,
Yeah.
So, it's, there's support groups. This generation was at the gym. They'd go to the gym. They had peer groups. They were in church activities. There's nothing like a visual face-to-face, but there's also something about making that senior feel valued and worth. And so find those things that they like to do, and do that. And if you go visit, be respectful, wear your mask, take hand sanitizer, take your shoes off at the door, and make your visit short, sweet, and be out. But there are things that we can do in order to bring them self-worth and value and joy.
I really like your idea, and you're spot on. I know my grandmother and so many others, they love to cook and bake and do those things. I like the idea of having them fix something that contributes to the meal, even though they may not be at the meal. It contributes to the meal, and that sort of gives them a sense of value. For a lot of seniors, they may have lost a friend in this year.
Mm-hmm.
I mean, they we've had 250,000 people die from COVID. Some seniors might know a good friend that they've lost in the middle of COVID. Any ideas on how you sort of console a senior that's in that kind of position?
Yes, we have unfortunately experienced that with my mother-in-law and her best friend, and Alzheimer's and dementia was in on that as well with COVID. And then you had anxiety and depression, and unfortunately there was a great loss there. And what we have to do is empathize in such a way that even though we may not have encountered this, as this generation's getting older, they're living longer, but they're losing more and more of their friends before COVID. And now it's truly, it's heightened, which really puts a great fear in them. So, it is really important as family and as a community to embrace them, take them food, take them something to eat, because when they have such a crisis that they've had in such a short period of time, and it was quick, they'll retreat. They won't cook food. And that's what they did when they lost somebody. They would take, they would bake something and take it to their neighbor or take it to their friend as a meal train, so to speak, what we call a meal train. They would take that to their loved one or to their friend. And, we can do something as well. Let's bake something, take it to them, let them take it or drop it off. But they need to get out. They do need to get out. They need to even sit outside and go. If it, like today's a beautiful day, please go get fresh air. You're fine. You're at your house. You're outside. Vitamin D is great, and fresh air is great. Those two things can do some wonderful things in such a tragic of a loss of a family or a loss of a friend. So, it's so dangerous because they're thinking they haven't had to go into this. I mean, they lived through the wars and the Great Depression, but they haven't had to live through this type of lifestyle. So we need to help them think.
Once in a 100-year event or pandemic, as they say. But before we run out of time, I do want to highlight you're also a small business owner. You own a home health agency. You're the CEO of that company. Actually, one of the larger home health agencies in our area. But you also sold like right before COVID. Um,
Yeah.
did you have some kind of crystal ball that you didn't share with all of us, or
I
um,
know it looks like that. I promise. I have told everybody. I am telling you, I have no connections with the government whatsoever.
I see. So
But
so
yeah.
talk a little bit about being a small business owner, and actually, being a woman that owned a small business. Talk a little bit about sort of what that experience was like.
Yeah. So if you would have talked to me, I've been in the industry 20 years, but owned it for 12. If you and I would have had a conversation 12 years ago, my answer will probably be different. I would say, there was so much rewarding outcomes from being a CEO. I can remember asking my husband, what's the benefit of me doing this? Why am I owning my own organization with so many rules? I mean, you understand, so
Yeah.
many rules and regulations. Can you please tell me what the benefit is? And so, I will say the greatest reward is the impact that you make on people. You leave a legacy on the people that you impacted over all those years. I mean, we served thousands of seniors, hundreds of employees, and the impact that you make on that when you leave, it speaks volumes for not just the title of leadership or CEO, but from a spiritual aspect. This was our ministry. This was our pulpit. This was our ministry. We use this as our pulpit. So if a caregiver couldn't pay their light bill, we would do that. If they needed new tires, we would do that. If they needed their rent paid, or they couldn't, a client couldn't buy hearing aids, we would do that. We used our business as a huge ministry for our own local community and our own body of people in need. And the reward for that is, my husband and I call it Kingdom Return on Investment, KROI. And so, the investment that you do in that, I will say, is the greatest reward. But there's a lot of grit and growl and dirt in the process. A lot of self-sacrifice, a lot of sleepless nights, a lot of tears, a lot of sweat. But we thoroughly enjoyed it while we had it. It was fun. And so, we've got another ministry that we're working on, and we're just going to continue working on that one. It's different. It's not home health care, but it's still impacting with people. So we're looking forward to seeing what that looks like in the next 12 years. Oh no, we left.
Shannon, you there?
We're back.
Okay, all right. I said, well, I knew I had you had froze up and I lost you, but yeah, you were talking about, and very passionately talking about, your just how the owning the small business was a ministry to you. And I was just going to chime in and say that that's been my experience talking to just about any small business owner. Rarely do I hear anyone say, "Hey, I'm doing it for the money," or it's all about money. A lot of times it's about passion, and it's about ministry, and it's about just giving back. One way that you and I reconnected was, I made a post about restaurants and just what it takes to really run a restaurant from a numbers perspective. But the fact that, a lot of restaurant owners don't make what you think they make,
Right.
but that's not really the reason they're in it. They're in it because they care about their employees and their customers and their community, and there's all these other intangibles that I think draws people into wanting to own their own business. Before we got to run here, do you think you're going to get back into home health, or what's next for Shannon?
Oh no, I'm definitely not getting back into home health. Nope.
No, you're done.
Nope.
Okay.
Nope, not doing that. We have another ministry that we're in with a business, and so I look forward to seeing where that's going in 12 years. Yeah.
I see. And you were in the home health business for, you said, what, 20 years?
20 years.
Wow.
Yeah.
Wow.
Yeah.
Well, I would encourage my audience to look up Shannon. She is somebody that's been around our community for a long time. Like I said, she at one time owned a very large home health agency here in our backyard. We also have a lot of mutual friends like Stu Epperson over at Truth Broadcasting and several others. And I found out the other day, she's a fellow Rotarian. You were in the Clemens Rotary where I started out back in 2003
That's where I started,
or 4.
yeah.
That's right. That's right. So again, you guys find her. I want to remind you once again, it is the holiday season. So go support JNS Cafeteria because they're going to support you if you don't want to do the cooking. If you got some elderly parents or relatives that you need to take some holiday meals to, let JNS hook it up for you. They've got cakes, pies, you name it. And so make sure you tell them Algenon sent you. This discussion here will be available later on our YouTube channel. So you definitely want to go subscribe there. That way you'll get a notification every time we post new content. If you like what you saw today or heard, make sure you click like. And then I also want you to share it with a friend that might get some value out of hearing this conversation with Shannon today. So make sure you do share that. And as always, I just appreciate everyone supporting what we do here. We've got a really interesting show coming up for you next. Tomorrow I'll be talking with Decide. Who owns Aperture, but Aperture obviously has been shut down because of what's going on with COVID. But we're going to be highlighting the top 10 Christmas movies that you have to watch this season. So we're going to have the top 10 on that. And then we're actually going to take every movie and pair it up with a restaurant so that you can know the food that goes with the movie. So I'm really, really excited about that conversation. So until next time, y'all stay locked in. All right, Shannon, thank you so much for that, man.
Oh, you're welcome.
I'm sorry I lost you there right in the middle of